What to expect after you've had shoulder surgery. The surgery needs to be protected for 4 to 8 weeks while the shoulder structures heal. Bandaging. You may have a bulky bandage on your shoulder. That is to cover your stitches and staples. It is very important to keep this covering in place to prevent bacteria and/or infection at the surgery site and to prevent disruption of the stitches and staples, unless told otherwise. Stitches and/or staples are typically removed 10 to 14 days after surgery. Sling wear. Following your surgery, you may have been provided with a sling. This is necessary for protection in the early stages of your healing. Slings allow the arm to have zero to little movement while also supporting it. Using ice. Using ice can be very helpful with decreasing pain and inflammation. If you received a cryopneumatic device prior to surgery, this is a demonstration on how to put it on while also wearing a sling. Ice should be used on top of the dressing and sling that you received after surgery, and in 10 to 15 minute sessions or 6 to 8 times a day. Your surgeon may have instructed you to move your arm prior to your first therapy visit. These pendulum exercises are designed to prevent shoulder stiffness while still protecting your surgery. If your surgeon has encouraged you not to move your arm prior to your first therapy session, that is okay. You will begin these movements at the therapy session. Notice how she does not use her operated arm to remove her sling prior to beginning her exercises. The pendulum exercises allow for limited shoulder motion while the shoulder muscles are relaxed. The goals of pendulums are to generate pain-free motion while maximizing the joint space. The goal is not about a lot of motion. To begin, bend forward at your waist with your feet shoulder width apart and your knees slightly bent. Place your uninvolved hand on the back of a stationary object and let your uninvolved arm hang loosely. Do not use your involved arm to create the motion. Importance of compliance. Common errors as shown here can damage the surgery. Using your arm to push up from a chair, using that hand to eat or drink, or using that hand to reach behind the body or behind your back. Even if the shoulder feels good, it is important to adhere to these guidelines to protect your surgery and to allow you to heal as quickly as possible, as well as achieve maximum function. We want you off to the best start as possible. Thank you.